With everything that we have to squeeze into our daily routines, our lives are busier than ever. We don't have the time to slow down when we're in pain. The idea of just having to push through pain has led people to rely on steroids or opioids just to get some relief. Prolotherapy offers a much better solution and provides better overall outcomes than options that simply mask pain. Prolotherapy is a regenerative therapy that not only manages pain, but resolves it. Prolotherapy causes damaged connective tissues to regenerate and repair at the site of injury. This means that prolotherapy doesn't simply hide pain the way steroids or opioids do. Instead, prolotherapy is directed to restore normal joint function and integrity and thereby eliminate pain from damaged joints. Prolotherapy is an in-office prescription technique that can be completed in under an hour. Afterward, you can immediately return to your regular schedule with no downtime. Full effectiveness of the therapy takes between 4 to 6 weeks as the body repairs itself from the cellular level, though many people note an improvement in less time. The procedure performed in our office uses 3 injections. The first solution contains an irritant, usually dextrose, which triggers inflammation, one of the body's first signals that injury has taken place, and recruits healing factors to begin repair of damaged tissue. The second injection is gaseous ozone, an unstable molecule which is particularly effective at oxygenating tissues at the site of application. Tendons and ligaments are not highly vascular. That means that their access to oxygen is limited. The combination of inflammation and free oxygen molecules at the site of injury provides a prime environment to repair tissue and resolve pain. The third injection is PRP. PRP stands for platelet-rich plasma and is extracted from the patient's own blood. Blood is drawn from the patient at the beginning of their visit and placed in a centrifuge where its components are separated. The platelet-rich plasma is isolated and prepared for injection as determined by the physician. Normal blood usually has a concentration of about 6% platelets. PRP extracted for the purpose of prolotherapy concentrates platelets to about 96%. These concentrated growth factors are then injected directly into the area that needs them. That's the entire process. Injection to cause inflammation, intense oxygenation, and precision application of your body's natural growth and healing factors. This combination doesn't hide pain, it resolves it. And it does so without reliance on steroids or opioids. Many people experience chronic nagging pain, but find the MRIs come up clean. Basically, the scans show no damage, but the pain is definitely there. Prolotherapy can induce the body to repair micro tears that MRIs can miss, eliminating the need to rely on painkillers when there doesn't seem to be any other option. Prolotherapy has been used by professional athletes around the world as a solution to resolve injuries and continue in their careers. But it's a solution that's available for the rest of us as well. If you're curious how prolotherapy with ozone and PRP could help resolve your chronic pain, give our office a call. We have free 10-minute consultations available over the phone to answer your questions and see if prolotherapy might be a good option for you.